And now, welcome to Healthy Veins, Healthy Legs, the radio program that gives you a leg up on how to identify and get help for ailments of the leg that can not only be cosmetically bothersome, but can actually be a big threat to your overall health and well-being. Now, here's your host, Mike Buck, and Hawaii's premier vein specialist and vascular surgeon, Dr. Robert Kistner.
Well, aloha and welcome, everyone, to Healthy Veins, Healthy Legs, like the man said. We're here again because Dr. Robert Kistner of the Kistner Vein Clinic has been providing you this program as a way of sort of educating everybody on how important it is to be aware of what's going on in your two pins, or your legs, as we call them. And you only have two of them, and you take care of them, you have a better life. You ignore the signs, you can have some problems. And we're very, very fortunate today to have another case study to present to you. And we're going to do that in a minute, introduce you to our special guest, Bob. First, Dr. Kistner, last week we were talking about two things. We were talking about varicose veins in all their stages, and we're talking about clots. Today we're going to talk about clots some more. Interestingly enough, though, I think people think that they're two different things. You can't have a clot without having a vein to have it in, but you can have a vein without a clot.
Well, absolutely, and different things can go wrong inside that vein. Mm-hmm. And so this is one of the two divisions, though, and the other is varicose veins.
Okay, now, we will discuss a little bit about the varicose veins and the difference between a cosmetic procedure and a surgical procedure for better circulation or for healing. But I think this is very, very interesting because we spent a lot of time, and we have spent a lot of time in the past on clots. And before we actually start talking about to our example here, Bob, let's talk a little bit about what a clot is, just so that people understand. It's sort of what happens when they cut their thumb and they watch it sort of stop bleeding, but it's inside a vein. Can they happen in other places? Can blood clots happen in other than in your veins?
Sure. Blood clots happen all over, and so blood clots are kind of divided into those that occur inside the blood vessels and those that occur outside. So if you cut your blood vessel and it bleeds, then it bleeds into the tissues, and when it bleeds into the tissues, it can form a blood clot outside of the vein, and that's has different names, hematoma.
I was going to say, don't a lot of people think that a hematoma or a bruise is a form of a clot?
It is, and so bruising is a stain, it's kind of a diffuse blood clot. And when that becomes a mass, then it's kind of a lump in there, and it may be tender. We call that a hematoma. That's a medical name for it. So those occur, and people have them. A lot of people will even have it spontaneously, so these are things that you may get, and it stains your skin. And then it'll have a life of what happens is over time that's reabsorbed and goes away completely.
I think some of the television shows that we see now repeat over and over things like blunt force trauma. Okay, so that's like a blow or a thump, and you get the bruise. So I think, are there a lot of people that get confused between a blunt force trauma, like a bruise, like you say, a hematoma, and something that happens on the inside of the vein? They appear to have some similarities, right?
Well, they're both blood clotting, but any blood inside of the vein should be liquid, and so that's a complex chemical reaction.
And of course, liquid's not clotted, right? Liquid's moving.
Yeah, but it takes a lot of chemistry to keep the blood liquid. I mean, it's kind of a miracle that it's always liquid, and lots is going on at the chemical level and physical level to make that happen. But when that's altered and it begins to become a blood clot inside the vein, it has a lot different sequelae or things that can happen as a result of that don't happen when the blood is outside of the vein. So that's the sort of thing I think we want to focus on.
Yeah, and today we're really lucky because, as you're going to find out when you meet Bob here in a second, is that a number of the different procedures that we've mentioned in previous shows have been used in the treatment of his condition over the years. Different medicines, different procedures, and different actions by doctors that we're trying to get to the bottom of it. So let's sort of ease into this as an introduction on how you met Bob, how Bob was referred to you, and why.
Let me just go back a little bit.
Sure.
It wasn't maybe 50 or 60 years ago, 40 years ago, that most of us, most of the medical profession thought that varicose veins often, if not most frequently, developed after blood clots.
Mm-hmm. Oh, I see. Maybe the other way around, actually.
And so which is the chicken and which is the egg? They're really two different processes. Either one can go on separately, or they can be sequential. That is, a lot of people with varicose veins will get some blood clots within the vein that's already a varicose vein. So, and those have different implications. So, just to let the audience know that there are two different problems. They may occur sequentially. They may occur both in one time. And they may occur separately and have a different lifestyle. You
know, you mentioned something, and I want to go back to something else earlier. We talked about a bruise or hematoma. Almost everybody that gets a bruise, at first it's a lump. You know, maybe it's a little red in the lump, and then it turns colors, and it gets to be, black or black and blue like they call a bruise. And then later on it gets like a yellowy color, and it starts to go away. Then it sort of goes away. Yeah. And this is a wonderful process that your body's doing all on its own, right?
Sure. And it's all your own tissue, and the blood just got out, and it has to be reabsorbed by the blood, by other parts of the bloodstream that go around and clean things up that shouldn't be there.
Do some of those things stay? Do they always dissipate, or do sometimes parts of them stay and you just live with it?
It's unusual, but they could remain as sort of a cystic structure, and even as a lump in your leg. But pretty much they resolve.
But see, I know from previous programs, if this clot happens in a vein, it's not likely to go away. You have to do something with it. It either stops growing or it becomes to a point where it's hindering circulation.
There are some people who think that we are forming these little tiny blood clots off and on all the time, but that's something that we can't prove because we don't know about it. We don't see it otherwise, so we can't really say that happens. But what we do see, and today is kind of an example. You can get blood clots in your leg and not have any symptoms.
Yeah, and that's what we need to make everybody aware of, because the hematoma that we talked about, where you get the bruise when you bumped into the lawnmower handle, you kind of know that, you can see it. But when you're talking about a lot of these things that actually have the potential for being pretty damaging to your health, you don't see them.
And another thing happens often. Just a fellow came in yesterday. He had a great big bruise in his arm, and you thought, oh my goodness, what happened? What happened turned out was that he stretched a little bit a few days before and tore some muscle, and it was bleeding into his tissues, and then it stained the tissues horrendously in the upper arm, and then that blood in the tissues tends to drain down from where it started down to the lower part of the extremity.
Sure,
so in the arm, down toward the elbow, and in the case of the lower extremity, to go all the way down to the ankle sometimes. So that's a discoloration that travels, and yet nothing is happening except the body's gradually reabsorbing something.
Now when we talk on this program, most of the time, folks, we're talking about the healthy veins and in the legs. And what we have talked about before, Doc, is that sometimes a clot that begins down in the leg is pretty far away from your heart or your lung, but given the right conditions, these things little pieces of them break off and can end up going right through your heart and end up in your lung, where sometimes they can be a problem.
Sure. So look, in the news not long ago, I think we were looking at Hillary Clinton. And she had something happen after trauma, and she had something
like a concussion.
Well, sometimes the blood can get loose outside of the tissue, in the brain or in the liver or somewhere, where it does some damage, and it can have a far-reaching effects. So that the blood clot you initially started talking about outside of the vein can really be a problem. It's still called a blood clot, and it could be confusing to the public. But in that case, that blood clot is usually outside of the vein.
Okay, and you know what, gang? Today, you're going to learn something that we talk about a lot here when we talk about the diagnosis and the treatment of varicose veins and clots, is this wonderful piece of equipment that's going to give you the ultrasound look, and that's really going to come into play as we meet Bob. I'm dying to find out some of the things that led Bob to your office, and some of the things that you both can observe along the way that turned out to be quite fortuitous, because I guess Bob was a pretty aware guy and knew there was something going on, and so did his doctor.
Well, he'll tell a story, but basically he had some trauma to his legs, and he was under medical care for several months for this thing, and was actually making a good recovery. And he saw his orthopedic physician, who noticed that he told her he'd had some swelling prior to that, and rather than just send him back to work, she said, well, we better find out why you have swelling in one leg. So it's a very important point for the public to understand that unexplained swelling in one leg almost has to be considered a blood clot until it's ruled out. And that is, you need to do a diagnostic test. But maybe Bob could tell his own story.
And first of all, Bob, thanks for sitting there quite patiently and waiting for your big grand entrance. But I think that almost everybody that listens to this program is either sometimes partly in denial or always in denial about what's going on in their body. So before we find out about your specific condition that brought you to Dr. Kistner and then the treatment, you look like you've always been sort of an active person. So let's talk about that a little bit about your background and maybe any chronic issues that you'd had before this came up.
Sure. Well, I'm not that active. I have basically a desk job, and so I try my hardest to, do some walking and some exercise, but, it's a challenge to do it enough.
What about as a younger fellow? I mean, were you an active person?
I look more active than I am. I'm a reader. I mean, that's my enjoyment and stuff. But I like being outside. And walking.
Well, that being said, though, Dr. Kistner mentioned a few minutes ago that you were going to an orthopedic doctor.
Well, right. I mean, the whole situation was that professionally I was at a conference on the mainland over on the East Coast. And at this event, I was talking to people. We were released to go to lunch, and I was walking down a rather dark hallway, and there were about 3 or 4 steps that I didn't see.
We can all relate to that, I'm sure.
I was walking, and I stepped just wrong where my foot was going out, and where I thought there would be floor, there was nothing. And so I went down, and both knees hit at the same place, same time, and the quadricep tendons kind of flipped back, and that was the condition. So I went into shock. And
on the spot. On the spot, into shock.
Yeah.
Okay.
And so they took me to emergency, and they looked
thousands of miles from home, by the way.
Exactly. Many thousands. So they took me to the hospital, and I have kind of a high tolerance to pain. So I was in the emergency room just watching all this stuff go by. And when they wheeled me in and stuff, they said, well, we have to do an operation on each leg. And so they did about a 45-minute operation on each leg, reconnecting the tendon. And then I was in recovery from that point. At a couple weeks after this, they air medevaced me back to Hawaii. So I was in Hawaii. And then about 3 months of physical therapy and all of this. And on the very day that I was released to go back to work full-time and to drive, I went in to see my consultant, my orthopedic doctor, and talked about that, as Dr. Kistner said, that swelling that I had. It wasn't much. He said, well, I'm being super cautious, but I'm going to send you over. And they did an ultrasound and said, well, bad news, life-threatening situation here. You've got a blood clot from your ankle all the way up into your groin, and we have to deal with it immediately. So I went to emergency and called my wife, and suddenly we were dealing with this condition.
Now, Doc, we've talked about this as a progressive thing before. But this was more of an incident, correct? In other words, when you got Bob as a patient, it was because of the fallout or the after effects of this traumatic injury. So the progression of this blood clot was probably a lot more rapid than a lot of other people get.
Well, several comments about that. First of all, the quadriceps tendon that Bob referred to is actually a great big muscle between the knee and the hip. It's a great big thing, and so some of that's muscle and some of it's tendinous. So it was just above the knee, probably, that you got your rupture. Is that correct?
I think so.
Yeah. So they did a surgical procedure there. Second thing is, you talk about the sudden onset. And so remember, we're talking about blood clots now, and they can occur at any time, and as opposed to varicose veins that develop over years. So this came on to Bobby's 50-year-old plus a little bit active person. Never had varicose veins, Bob?
No, not at all.
Okay, so never had anything wrong with his
Not
veins.
even those ugly little spider veins that most of us have. Huh? Good, lucky you.
Not that I remember
lucky you.
or anything.
Yeah.
My mother had them quite bad.
Yeah.
Okay, so
Dodged the bullet.
So he was a virgin.
Yeah.
There he was, and
Newcomer.
Nothing wrong with his veins, and there it is. But he didn't really have a problem with his veins at that point. He had trauma. Something happened to him, and so he had a process of healing, and included some surgery, which he went through very well. Got out 3 months later and was doing fine. And then, as a surprise, a total surprise to him, a little bit of swelling in his leg turned out to be this external manifestation, the only symptom that he had, that this blood clotting process had been going on.
Okay, you know, Bob, when doctors talked about this in the past, when we talk about this swelling being a wonderful Mother Nature's indicator that, hey, we have an issue here, that's why we're swollen. Did you actually notice a size difference, or did you have other symptoms like tiredness or heaviness or aching? What was the trigger, in other words, that made you go take a look?
Yeah, well, part of this thing is that, in recovering from the surgery, my legs were absolutely straight with this brace on, so it was hard to move and stuff.
Okay.
And so I was not very active, and they said, well, it's important to move around and put on this kind of sleeve around it that would move the muscles up and down or something like that. I wasn't really warned about anything particular, just to report any conditions.
Sure.
And so it was in my mind, a very slight swelling that I elevated my leg overnight, and then it was completely gone, no discoloration. Gave me several things to check for: discoloration, pain, swelling. And I just mentioned a little bit of swelling, and that was it.
Where was the swelling?
Right around the ankle.
Around the ankle.
Mm-hmm.
Nothing to do with your thigh or anything like that?
No, not up there at all. Not up there.
Okay.
Yeah, pretty interesting, Doc, because, sometimes you'll talk about somebody that gets one leg that gets swollen a lot. Then it's pretty obvious, but this was subtle. But still he was able to observe it. Do you think, and not thinking for Bob, of course, but do you think that maybe part of that was the fact that his other doctor had prepared him by telling him what to look for or what might happen, and if so, come see me?
I think he was just going in for an examination to go back to work. Is that right?
That's right. And she was saying, well, how are you doing? And I said, well, here's something I noticed. And it was the ankle was a little swollen, and the foot itself seemed, kind of...
Was it swollen to the point where a shoe irritated it, or was it harder to put your shoes on?
I wasn't wearing shoes or anything like that. I'm still pretty much
we're in Hawaii.
Convalescent.
We wear shoes
when
we have to,
Yeah, I wear Birkenstocks all the time.
So in medicine, you got to be lucky. Mm-hmm. And to survive a long time, you got to be lucky, it seems like, for many people. But this was lucky. In retrospect, you can say there was some swelling, but he didn't know how long it was there, do you?
Well, it was there for a very short time. I mean, he said, I had some swelling, it went away and returned to normal. And then I went into my regular checkup expecting basically to start working and pushing myself. So, at that point, I wasn't really thinking of anything. I mean, I was completely shocked that this had happened and that it, I didn't even know what a blood clot was. I thought a blood clot was this little thing.
Yeah, all of us, yeah.
And then suddenly they're describing this thing that just socked out, 3 of my main veins, and it's like, well, that's interesting.
I've often commented on the program, when you go to Dr. Kistner's office, and I'm sure many others, there are these wonderful diagnostic tools that are used and then records that are kept. And you've got this interesting drawing, Doc, that we've looked at on my own legs and now Bob's legs, where you actually can show a patient, where the problem area is and what the problem is. So here comes a guy that was it just sort of blindsided by first an injury and then the treatment, and then, what do I got to do to get things back to whatever normal is here?
That's right. And is that what he wanted to find out that day or even thought about? One of the things we might point out as we go along is what would have happened possibly to him if this didn't occur this way and he wasn't lucky to find it. But
we call that the scare factor part of the program, where an untreated or if you're not stimuli responding, that you can get yourself in pretty deep trouble.
And that's one of the values of talking to the public, that there are little warning signs like swelling in one leg that people might want to just keep in mind.
Yeah, because see, a lot of us that are listening to the program don't need to have a doctor sign off so you can go back to work. You're just going back to work.
Yeah, that's right.
It comes Monday, you're going back to work again.
That's right.
Yeah.
That's right.
Okay, but nonetheless, Bob got referred.
So yeah, he did. So what we do when a person comes in with swelling in one leg is look at them with an ultrasound study, which looks right through the skin and visualizes the veins and the blood flowing in the veins, and we can see whether it's normal or if there's any abnormality. It doesn't hurt. There's no sticking of needles. There's no pain attached. It's just put a little probe on the skin and look at the screen, and there it is in color. And when we looked at his leg, we saw this blood clot. And so what that means is that the veins that start in the foot and go all the way up the leg, and then it's this channel of collecting tubes called veins, and they carry the blood from anywhere in the tissues back to the heart. And this one was all jammed up with blood clot.
Right, and this, by the way, when we've talked about blood clots in the past, you can talk about something as small as the tip of a pen, or big as a dime, or a series of them. And this had gotten to a point where, if my memory serves me right, was going pretty much up one vein. I mean, right up the leg.
This is pretty much 2.5 feet long.
Yeah, I mean, it's not like it's not a little blip. It's a big blip.
It's an eel. It's a big eel.
But the thing that I think that is incredibly interesting here, Bob, is that you had no indication of this.
Well, that's right. There was no pain that I could tell at all. I mean, this is where I first kind of realized, having a high tolerance to pain is not always
maybe not a good thing.
Yeah.
Okay, so Doc, you administer this. And I know, because I know your guys and your folks down at the clinic, you probably said, holy smokes, look at this, because it was 2 feet long.
That's right.
Yeah.
But that's what happens. And so that's another message, that what Bob is saying, he had no clue. These things do happen silently, and now sometimes people get a little twinge of something, and then it passes off so they don't pay attention to it. I don't think you had that, did you, Bob, of discomfort? Were you having discomfort in your leg with your recovery from your operation?
No, not at all. It was going pretty normally, the recovery.
Yeah, and maybe, do you think that, once again, going back to your original physician, your orthopedic surgeon, obviously, or your orthopedic doctor, obviously gave you a pretty good primer on what to look for, and maybe some things that, hey, if this happens or if that happens, I need to see you. But they didn't. It didn't sound like you had too many warning signs.
Well, I didn't, and that was the thing. I mean, the way in which she described them, it seemed like, I was looking for something a lot more macro than I was experiencing. This was a pretty minor thing as I was reading it. A little bit of swelling, went down right away. And she was saying, watch out for pain, look at discoloration, a lot of specific things that really didn't go with this at all.
Now, she wasn't the operating surgeon.
No, she
wasn't.
wasn't.
You were elsewhere.
That was the accident that happened when you were far away.
Right. So this is really an alert orthopedic consultant who's taking care of you.
Yeah, I think this is wonderful. I mean, what we're talking about here is that, and let's be honest. I mean, what happened to you, Bob, is you were at a work sort of convention in a city that had facilities. You can imagine, had this injury or this trauma happen to you in the in the Sudanese mountains or somewhere where there was no clinic.
Right next to Johns Hopkins.
Yeah, you're going to get, it's physician heal thyself. I mean, you're right there in the middle of it.
That's right.
So anyway, Dr. Kistner, once you were able to determine that here has this, in the year of the snake, there's this snake inside Bob's leg, this big old clot that's 2 feet long. Now what?
So that's a big deal. So it has serious implications. And just for a minute, what are those implications? Blood clot will begin as a small, like a pebble or something, and inside the vein. And that grows by a process of accretion. That is, the blood around it tends to stick to that blood clot, and so it grows as not liquid blood, but the liquid blood around it congeals on the top of this thing, and it tends to grow both ways in the vein, down toward the foot perhaps, but more likely it grows up toward the heart.
Mm-hmm.
And so this thing may have started anywhere around your knee, Bob, and as it did, you weren't aware of it. Your tissues were healing. I don't know what was going on, but you were not aware of it. That thing could have been growing for as long as 6 weeks. We can age some of these, and so that would be my guess that it had been there for several weeks anyway. But until it blocks what happens in the venous system, if you block a vein, then other veins constitute. If you block Main Street, well, then some of the other veins around the way, other avenues around the way, can take over for that. So this must have grown so slowly that you didn't get swelling. Nothing that you noticed all this time. And as that grew, it grew from your knee up to your groin, and actually was on its way up into the pelvic vein. Very long distance, no symptoms at all, until it finally got to the point where it blocked the outflow from your vein through the detour routes. So what happens, the veins are a collecting system, and they all kind of come together at the knee, and then they all kind of come together in the groin, and there are various ways, various funnel points where they tend to come together. It wasn't until it got to your groin that it became clinically obvious that you had some swelling, and even that was subtle. But had you not gotten it caught at that point, the next thing that probably would have happened, it would have blocked the next vein up the way, and then you would have gotten a great big swollen leg.
Now, I'm thinking in the past, when we've discussed this chain of events, that at any point in time during this pretty rapid growth of this clot that got bigger and bigger and got up to the groin, little pieces of it could have dislodged and gone speeding up in the good blood into the heart and into the lungs and become a much bigger problem than a swollen leg.
So you are absolutely right. So what we did was ask Bob, did he have any symptoms of shortness of breath or coughing up of blood or abnormal breathing and shortness and so forth? And I think the answer was no. But in the process of understanding what happened to this clot, it was clear that this thing had grown up to become a major blood clot in his leg, but also just what you're saying might have happened, that little pieces had gone to the lung without causing symptoms.
Mm-hmm.
So we did something that we examined the blood vessels in the lung with a special test, and that showed that he did have some blood clot in the lung that had not caused any symptoms. And exactly what you're saying, as this thing grows, and it grows by this process of accretion with little bits of blood clots hanging onto the growing blood clot as it marches up, those pieces can break loose and go to the lung. You won't have any symptoms likely with the first ones. But it sets the stage that if enough of those go up and block various parts of the lung, and then another one comes up, it can be a very big event, can even be a fatal event. And so one of the major causes of sudden death is a process like Bob had, going up his leg, blocking off parts of the lung, and then all of a sudden a big one blew off because the vein got up into the clot got up into the big veins. And then a piece can blow off that can actually block the blood flow in the lung.
Okay, now just out of curiosity, during your rehab and whatnot, from going back to the injury itself when you got hurt, were you on any sort of a medication? Bob Kistner has talked often, Doc, about blood thinners and different things that you give to people for different reasons. Were you on any sort of medicines to aid in your recovery or prevent things like clotting?
Yeah, I'm trying to remember, and I don't think so. I think Coumadin was actually I was using that as a result of the vein situation.
Mm-hmm.
But before that, I think I had some painkillers, which I wasn't using very much at all. So
because you're tolerant to pain. So Dr. Kistner, when he talked, we've used this Coumadin and heparin and some of these other things that have come up in the past. Was that something that you prescribed or something that he was already taking?
No. He was taking nothing.
Mm-hmm.
No. As soon as you make the diagnosis, well, then immediately they go on to
treatment
heparin.
Of some sort of treatment.
Yeah, treatment right away. And so there are various forms of those treatments. One of the treatment is the usual anticoagulant, which in an injection form is heparin in it, that can make you anticoagulated right now. You know. Or it can be a pill, which takes 2 or 3 or 5 days to become therapeutically effective. And that's a much more gradual process, but it's only a pill instead of an injection. So we have those two choices. The pill is called warfarin or Coumadin, most likely, and there are many new forms of that, which we can talk about later. But anyway,
I'm sort of curious because I'm one of these knee-jerk, I want this fixed right now kind of people. And so I would say, why would you even think about taking a pill that could take several days if you can have a shot and walk out the door?
In this situation, you go right to a shot.
Yeah.
Yeah. And so, it used to be that you had to give heparin as an intravenous injection with careful monitoring. Now, with the developments of something called low molecular weight, a special fraction of the heparin molecule, it's so safe that you can just pick it off the shelf, ask a person how much they weigh, and give them a certain dose, and it's very safe, and it stops the clotting. Bang. 97% stop of the clotting process. So this thing doesn't grow, and it doesn't send blood clots to the lung any longer.
Okay, Bob, I'm still I know that our listeners would like to know at what point in time, if ever, you got worried or nervous. I mean, all of a sudden, here's something that's coming out of the blue at you, and even though you were referred by your orthopedic doctor to Dr. Kistner, now you didn't know Dr. Kistner or the vein clinic or have any of those concerns in the past. At what point in time did you ever get nervous, or did you always feel, hey, I'm glad to know about this. You're a voracious reader anyway. You're probably, checking out as much as you could on your own. Did you feel right off the bat that, I think I've done the right thing here. I'm doing what I need to do to get healthy?
Yeah. Well, remember, basically I was dealing with a leg injury and healing from that, and it seemed like it was healing quite fast. It was going well, so I'm looking at basically becoming ambulatory and still being able to walk.
Sure,
and
go back to work and all that good stuff.
So, and when the doctor said, "Well, I'm being super cautious, sending you over to the vein clinic," I'm looking, well, okay, that's good. I like to be cautious, but I'm basically all happy about pretty much facing, just the downslope of recovery here. Yeah. So I don't really worry until Dr. Kistner's people say, well, you've got this.
Yeah, I was going to say, this is where
that's when it gets real serious.
Yeah, I was going to say, this is where the bedside manner comes in, because you can say, I got some good news and I got some bad news, or I've got some bad news and I got some worse news. I mean, Doc, you could explain how important it is to have that relationship with a patient so that you can ease somebody into the reality of how close they are to really needing some treatment. Otherwise, there could be consequences.
Well, it's never pleasant to hear something you don't want to hear.
Of course not, yeah.
In retrospect, it becomes all right. And so a person like Bob takes it and says, well, let's get on with it and find out what's going on, and wants to know what the next step is. And so he was very, very cool about it. Not everybody is. Lots of people, lots of people have heard stories about blood clots, and that's one of the things we're trying to do is trying to warn people, but on the other hand, reassure people that there are ways to take care of these things.
So what you said was
he handled it well.
Yeah, what you said is step number one. Immediately had the ultrasound and found out, wow, we got 2.5 feet we're dealing with here. Blood thinner right away. Something right away to so you can figure out what's next.
Yeah, so I think literally with him, he came with a little bit of swelling, and we find this in. So the immediate thing is to inform the person, well, you have something here we have to look at. And this shows that there's a definite blood clot, so we have to find out what it's done, and we'll go on to the next step. And then that usually, in this case, will go to the hospital because they need to refine tests to find out what's in the lung. Immediately before they go to the hospital, we start them on the heparin just right away in the office. And so they're therapeutic at that point. And then from that point on, we work up their blood to see if we find out if there's things in their blood that tend to cause blood clots. We treat and find out if the blood clot has extended farther than we could tell with the ultrasound study, and that's different kinds of visualization. And we look at the lungs to see if it has extended up there.
So, and I'm thinking, Bob, you're thinking to yourself, here I go again. I thought I was done with this stuff. Now here I am. What am I doing in the hospital, for heaven's sake? I want to go back to work.
It felt the same way. I mean, suddenly, I fell down the stairs and I have no idea what's going on, but it's much bigger than I had any reason to expect.
Sure.
And this felt exactly the same way. It was totally unexpected, not anything I was thinking of or knew anything about. And so when they said, okay, you've got this, and the going to the hospital is right across the the street, and suddenly I'm dealing with a whole other thing. It's almost the same, psychologically, the same experience as I had before.
I think, erring on the behalf of being cautious, Doc, maybe it's the reason once you all notice that these things are present, or the symptoms or the probabilities are present, it's not like, well, let's think about this and come back in a couple of weeks and we'll see how you're doing. It I guess indicated that, hey, this needs to be pretty much treated right away.
Yeah, there's no thinking now. You got to. Well, I mean, there's a lot of thinking, but but you got to move. I'd like to ask Bob, what's the next thing you remember? You went to the hospital. What's the next important thing you recall?
Well, I think
this is 7 years later now.
Yeah.
How long?
Well,
5 years later?
I remember it a little bit vividly. I mean, at some point I'm in the hospital. I call my wife. Of course, she gets the same shock really quickly.
Sure.
And comes down, and then they're saying, well, we have to move quickly. We have to operate, or here we're going to do this. If it doesn't work, we're going to do this. So my main memory next is signing a release thing saying, well, okay, here's the odds of surviving this thing, and you understand these sorts of conditions. So, at this point it becomes very real for both of us. And then I kind of remember being on a table, and they're kind of exploring whether to, and I guess this thing is such that it's not going to be removed, but they're doing different things. They tried to put a catheter or something down the leg, and I remember that didn't exactly take, so they were doing several kinds of things physically as well as chemically to this situation, and then I'm on sort of a recovery thing. And a lot of this past the operation and the experience initially then has become really normal. The recovery happens. I mean, it seems to me like the ancillary vessels took over. My circulation seemed kind of good. So at some point I'm not noticing very much except these initial shocks of a big thing happening.
Yeah, I think that's interesting. And I've felt as a patient, not just doing this show, but that educating me was, I mean, nobody wants to hear there's something wrong with you, but when you find out that there is, and you find out, well, okay, this is what we're going to do, Doc, it's because of technology, because of the ultrasound, and your ability to really get into this and take a look at it, number one, but also that it seems like there were several different paths that you went down with regards to treatment before the ultimate treatment, which you got rid of the situation.
So Bob really had to process a number of choices, and without getting too detailed, there were choices. One could be a surgery to open up and try to lift the clot out and disobstruct the vein. That's a possibility. Another that he did choose was to run a catheter through another vein and get down into the clot and then inject a medication that not just stops the blood clotting, but actually causes the blood clot to melt.
Folks, I've seen these things that we're talking about here, these catheters. I think once again, microtechnology and everything has really done this, because when people think this, they say a big pipe that they're looking at on the table. The catheter that you were able to put into Bob's vein was how big?
Well, it's a fraction of a centimeter. It's a few millimeters in diameter, so it's
tiny
small.
little thing.
Yeah,
right.
It's very small. And they can be very, very tiny. But that's not that it was a big catheter. It's that it provides a channel through which a liquid can go and do its thing in the blood clot. So it's a tiny thing, but it's a matter of precision, and it has to be delivered just to the exactly right place. Now, you're working with a blood clot that may be fragile, so you don't want to break another piece off to send to the lung.
Sure. I was going to ask you about that. What are the dangers in treatment?
There are.
Because you're in an area that's pretty volatile. Otherwise, you wouldn't be operating on it, right? And that's the whole purpose of it.
Right. And so this requires expertise. In this case, he was in the hands of endovascular expert who can place these catheters appropriately. And this is done in the hospital under careful monitoring with fluoroscopy and X-rays and so forth. So that's what that's the table that you remember.
Yeah, in other words, Bob, not in a tent somewhere in a third world country. I mean, it speaks highly of what we can do these days.
That's really, I think, critical to how I experienced all of this, was that at some point you can say, well, Bob made a choice, but Bob doesn't know what's going on here at all.
I don't know. Whatever you think, Doc. You're the doc.
No. But you made a choice. Well, one was to do this when had a certain risk of the medication causing some bleeding somewhere else, and so that's a percentage risk. You were looking at life. Remember, you were talking about life and death. There is that potential, so you have to be informed that you're taking that risk when you take the medication. One of the other alternatives would have been we'll just open your tissues up and we'll try to lift the clot out. Okay, well, that's a possibility. And so you might have made that decision, or we might have recommended it. I don't recall exactly how that went. And the other one would be say, well, look, let's just leave the clot there and prevent it from growing anymore, and I'll accept a swollen leg. I don't want any of these risky things. Mm-hmm. So those were really the risks you made.
But you know what I'm curious about? You mentioned earlier when I was asking you about your other, your history, that your mom had vein issues. Did she have treatments or things that you can remember that were painful or that would have made you think twice about having a procedure? Because I did. I mean, I'm asking that because my mother had bad varicose veins as a sales lady her whole life, right. And it was just not pleasant. The treatment that they had back in 50 years ago wasn't so terrific.
My memory there is that my mother did have this condition. She was also the same thing on her feet in the stores. And, I don't recall her ever really being given much information on it in terms of treatment. I think it was more she dealt with it.
You know what? Let me ask you this, because I remember back in the day, after work, after I came home from playing baseball or out in the, my mom was always in the same place with her legs up in the air because that's what made her feel better. She always had her legs elevated in the evening.
Yeah, there was a bit of that. Yeah. Going back to the choice thing, for me at least, it for both times, it was like at some point it became clear to me, at least in looking at it, that I was dealing with a surgeon in the case of being over on the East Coast that knew what he was doing, and I could put that confidence in. The same thing with the vein clinic, going over to Straub, and they say, oh, you're working with Dr. Kistner. Okay, this is the best person within, 1,000 miles that all studied under him and all of that. And that allowed me to really look at these options in a completely different way of saying, well, this is a possibility, but, it's not likely to be able, it's not an easy thing to do to lift that vein off at this point.
I'm glad you brought that up, and let me tell you for two reasons. Everybody that watches television anymore at night, particularly, they see these different medicines being advertised, and, they spend 30 seconds telling you how great they are, and then they spend a minute telling you, but here's the thing, some things that can happen if you take this. It seems to me that the medical profession, and specifically Dr. Kistner, went out of his way to make sure that you knew not just what the options were, but what possible consequences there might have been towards each option.
Yeah, and that was very clear. I mean, I knew I could see very much what was going on, and as I was given the options, I mean, it seemed in each case there was kind of an obvious best choice. Yep. It wasn't dramatically like, well, this one is going to cure you completely, but it's 50% you'll die. I mean, it wasn't that kind of situation.
That's how I feel when I watch those TV commercials.
And part of it was just feeling really confident that everything was being described so well that I could understand it, even though, all of this stuff was completely new and I wasn't expecting anything.
Because, Doc, you did say that one of the alternatives would have been to just say, okay, we know what's going on, and you don't want any of these treatments, we'll live with it. If there are any more symptoms that come up, then we got to do something. In other words, you just can't ignore these things once you find out that they're there. So that's what it sounds like to me.
But there are choices, and dealing with a lot of people, different people make different choices.
Sure.
And so I'll tell you, it's true that the person makes the choice, and what they base it on, whether it's, well, I trust the institution, I trust the doctor, or I don't. And my mother had a bad experience, and so I'm not going there. Well, if that had been your response, that's where we would have gone. And so the individual, and that's what the legal profession insists on.
Sure.
In this country.
Well, I mean, here we are today, and Bob's with us, so obviously some pretty good choices were made, and we're living to tell about it. But I think that when you're talking about it now, once you had explained all the options to Bob, what was next? What did you do?
What did we do?
Yep.
We did put a catheter in to try to melt the clot, and the clot did not melt well. Mm-hmm. So he had a clot from below his knee to above his groin. But there are critical areas there. Remember, that clot was not symptomatic for all that time until he just got a little bit of swelling. So we figured that some part of that clot must be meltable. And it turned out that the part that we call it lice, but it means melting of the clot, it melted in the top, 3 or 4 or 5 centimeters, a couple of inches of the vein, but that's where the other vessels and branches came together. Mm-hmm. Remember I talked about a funnel? Sure. So the branches came together. By having the clot melt out of that area, then the other branches that had been preventing you from having symptoms could reestablish flow. Now, if those branches are still not clotted and the valves are functional in those branches, it may be that leg will go back to normal, even though the mass of the blood clot in the thigh still stays in that.
Because your newly created, routes are circumventing the clot. They're just
got good detours.
Yeah.
Effective.
Yeah.
Now, he happened to have that, and so because that turned out to be that way, he got a very good long-term result. Had he not had good veins around that, and they had been clotted, or maybe if he'd had varicose veins all of his life, he wouldn't have such a good result. We couldn't tell that at the time. But anyway, what happened to him was he was in the hospital. Part of this clot melted out. We didn't know whether he had a good result or not, and he came out of that. And then he went through a long period, I'd say 6 months to 12 months of using anticoagulation by mouth, the Coumadin or the warfarin, wearing support stocking, doing physical therapy, getting over all of his things, and returning to work, and watching the clot with the ultrasound test from time to time, that it turned out that he was going to get a great result. And so this became evident. I don't know when it became evident, Bob, but there were some months where we weren't quite sure. Do you recall that?
Yeah, I mean, great result is kind of interesting because, after the first injury, it was like, I should be able to walk pretty well. Mm-hmm. It should recover completely. That wasn't really the way I thought about the blood clot. I mean, this blood clot is going to stay there. It's physically there. The ancillaries may take up the thing, but, those are not meant to do that, so there's no valves. There were all kinds of scary things, not scary, but uncertain things.
I'm glad you brought that up because it seems like we can trace all of this stuff back to one accident, mm-hmm. Where you had this slip and you hurt your knees. It's amazing what great machines our bodies are until you jam them up. But it seems also that this injury has sort of played out its threat to you. In other words, it's pretty much handled. But what about ongoing care and ongoing visits? What makes you revisit this?
Well, part of it is just, I guess I'm being sort of super cautious
mm-hmm.
too. I mean, because I didn't notice anything, before the blood clot, really. I mean, just this minor swelling and such. I'm kind of looking like, well, I mean, at this point, I'm going in once a year just to see how it looks and comparing it to the other leg. And part of it is just really saying, well, what if something else happens? I'm not so confident that I would notice it in any real way again, important. Based on my experience.
Yeah, and Dr. Kistner, I think that's really important because these some of these injuries or some of the conditions that certainly Bob has experienced are something that requires monitoring, and I guess maybe there's no rule about how often it is, but it seems that he's at least staying on top of his, like you do to a dentist or an eye doctor or somebody, is to get checked up annually or semi-annually just to keep an eye on things.
Well, that's right, and it's one of the problems with that is how much of the necessity for follow-up is supported by the insurance companies.
Yeah, that's the key issue, by the way.
It's a big deal, and their policies are generally that if you have any symptoms or if you have a reasonable need for checking up, they'll support it. But as we get into tighter and tighter economic times with medical care, I think some of that willingness of the insurance companies will be taken away.
Is the big area here the value of the ultrasound examination from time to time that tells a lot more than you can ever see. Is that something that might be threatened by not being covered, the ultrasound examination?
Absolutely, and of course, and even the physical examination. You know, so much of this is it's an accumulation of a physical examination, minor things so called, but easy to see. But if you don't see them, if you see them, they're very important. Just like a little bit of swelling, that's what saved him totally.
Sure.
You know, had this not happened and she had not picked that up, he could have been seeding blood clots to his lung for a long time. He could have put him into dire straits as far as his breathing is concerned.
Let me ask you something about that, because, you know, I think that everybody's worried about something happening instantaneously. Are you telling me that if you have blood clots that go untreated and unchecked, that little bits of pieces can come off them from time to time, end up collecting or coagulating into the lung, where all of a sudden the lung is less able to function because there's so many little pieces of this clot in there?
That's exactly right. And so this sort of thing goes on a lot. And so one of the major causes of sudden death, the heart, but one of the second or third things is just this process of blood clots traveling to the lung, being no symptoms until the big one comes, and then it's all over.
Yeah, and, you know, I know a lot of people out there listening are struggling with resolutions to do this or do that, or to get more exercise, or to stop their smoking, and we never asked you that during the conversations, Bob. You know, during this time, apparently, you know, your lung is really affected by smoke. Were you, or have you been a smoker in the past?
No, I've never been a smoker.
Yeah, and Dr. Kistner, I know that there's no way we can give him a gold star on his chart for that, but obviously this was probably a pretty healthy lung. Or he had pretty healthy lungs to begin with. Otherwise, this could have been a worse issue. Yeah.
So when we start out life and grow up, our lungs have 5 or 10 times the capacity they need in order to sustain us. You know, and then we process of life we use up.
It's called getting old. You know.
Yeah, right. Yeah. And so, but he had preserved himself very well, and he was a very, very fit guy.
And I kind of remember too that, you know, the warning about the blood vessels going up into the lung, but I also remember going up into the brain, and that was kind of scary to me too. That,
sure.
You know, I'm not sure how that's kind of related, but at some point going up there, even a small blockage, of course, would be a major.
Let's talk about that for a minute, because it really confuses a lot of people. So you're what we're talking about is the circulation, and the circulation in the veins goes up through the heart and out of the heart to the lung, which is a filter. So that's where all the blood goes. There is one detour route. There's a little bit of bad news about that, is that if you happen to have a hole in your heart, then as it goes into that side of your heart, it can go through that hole and come out the other side of the heart, where it goes out the arteries and could go to your brain. Very rare, though. Very rare. I mean, it's a possibility, and so you can never say that can't happen. But usually a stroke related to a blood clot in a vein is not going to happen. And that's the thing that so many people are afraid of. Well, I have a blood clot, I don't want it to go to the brain. But there are many blood clots that can go to the brain, and they generally come out of the heart. And so people with this condition of abnormal rhythm, like atrial fibrillation, you've probably heard that term, and a lot of people are under treatment for that. Those people are at risk for the little blood clots going to the brain. So you were really much safer about that than you might think.
I was worried about a lot of things.
Sure. Well, I think that we all have this worry for a long time in our lives. I guess, especially alpha males, we think we're bulletproof. You know, nothing's going to happen to us. And then when it does, you realize how thin of a line it is. And gee, I think whatever I was doing to foster this condition, I'm done with that. Whatever it is, fix me. It seems to me that you've been able to certainly return to all the things that you do. That you work, you're busy, you like to read, you like to walk, you like to do. Is there anything that you can't do as a result of this injury?
That's been interesting about looking at going back and during this process, because in the last couple years, what I've noticed is that after the ultrasound, they say, well, there's a little bit of recanalization. In other words, there is a little bit of flow. And how does this relate to your activities? Because two of the things that I cared about a lot were being able to hike and walk. And that I was able to do for a while. I was walking up Diamond Head every morning before work. And so I didn't notice any restrictions there. The other thing I like to do, and which I asked if I could, and they said, well, it's unsure whether you can do this or not. I do Zen meditation in cross-legged, and of course then we, during a session or a retreat, we'd go from 4:30 in the morning to 9:30 at night meditating, and they said, well, just see how that goes, and I've been able to do that, so that was kind of interesting, and it was watching. That's another reason to make sure that as I do those kinds of things, going back to what I need to do, what's the result?
Well, listen, I want to tell you how much we appreciate you sharing your experience with us today, Bob and Dr. Kistner. Once again, we hope we answered a lot of people. And if you like this show, tell everybody about it. Thanks for being with us here today. We look forward to seeing you again. If you'd like to make a comment about the show or ask Dr. Kistner's website for something to be included, you can go to KistnerVeinClinic.com, www.KistnerVeinClinic.com. Have a great day. We'll see you next time. And remember, healthy veins, healthy legs. Until next time, aloha.
Thanks for listening to this edition of Healthy Veins, Healthy Legs. For more information, go to www.KistnerVeinClinic.com. That's www.KistnerVeinClinic.com. And join us again next week for Healthy Veins, Healthy Legs on AM 690 KHNR.